aware of this marijuana solution.
The Marijuana Solution would like to remind you to check out our sponsors after the podcast. We're going to have links to them in the description. Our sponsors are Trulieve, Sunshine Cannabis, The Smart Collective, Minorities for Medical Marijuana, and We Are Rare. Don't forget to check out those links in the description. And if you haven't done so already, go ahead and subscribe. Leave us a review.
We're Florida's first licensed medical cannabis dispensary with locations all throughout Florida, and we deliver all throughout Florida next day. We have the largest selection of products within the allowable delivery methods. Trulieve products are hand-grown in an environment that keeps it as natural as possible at every turn. We don't use pesticides, and we lab test our products, and those lab tests are published on our website, so you can be confident at the medication that you're putting into your body. Our favorite products are our vaporization lines, our True Pod, our True Clear is a patient favorite, and we also just recently launched True Flower for patients that want the full entourage effect. At Trulieve, we're really proud to offer the largest variety to patients, and we're really excited about the future and all of our patients that are helping us expand and grow and make our products even better. Visit our website at www.trulieve.com to find out where all of our dispensaries are located, shop online, learn more about our products, or find a doctor if you haven't gotten started in the medical cannabis process.
Hello everyone, you're listening to The Marijuana Solution, and I'm your host Robert Roundtree, and this episode we're speaking with Dr. Jenny Wilkins. Dr. Wilkins is one of the foremost natural medicine doctors. She is also a TV personality with shows on ABC and some other networks, and she is the CEO of AgeVital.com, and she's also a really well-known speaker and advocate in the cannabis community. She just recently keynoted the Kaya Fest, which is the Marley's big festival out in California. And she's going to be speaking next week at the Florida Medical Cannabis Conference and Exhibition in Sarasota. How are you doing today, Dr. Wilkins?
I'm doing great. How are you, Robert? Thanks for having me on your show.
Oh, I'm doing great as well, and thank you. It's an honor to have you on. First off, I would like to obviously thank you for coming on, and thank you for what you're doing. Obviously, everybody knows the stress and issues that go on with being a natural medicine doctor these days, and I just want to thank you for what you're doing to carry the message forward for everybody.
Thank you. Yes. No, it's a tough job, but someone's got to do it. You know, I think it's necessary right now, especially in this country, to provide the consumer and even the doctors, to give them the tools that they need to be, the best doctors and having the best outlook for the patients, because patients really don't have access to, natural alternatives.
Yeah, they sure don't, and they're generally have a really bad stigma attached to them from the top down in our government and society from different alphabet agencies. Could you kind of give everyone that's a Marijuana Solution listener a quick background of who Dr. Jenny Wilkins is?
Well, I speak internationally, number one. I'm the owner of AgeVital Pharmacy Research and Wellness Center. I sit on multiple clinical boards, including, medical director for Biome Pharmaceuticals, which is a CGMP, facility that does clinical research on the human microbiome. I'm also a senior business and financial advisor for Nuvos cryptocurrency, which is all for the cannabis industry as well. I'm the medical director for M3 Bio Dynamics and M3 Life Sciences, which is a cannabis dispensary and a research facility out of California. And I have, I'm executive board of directors for the American Academy of Medical Marijuana Physicians, and the president and chairman of the American Academy of the Endocannabinoid System, and also the medical director for the Medical Cannabis Alliance Organization. So I do a lot with the cannabis industry, and it's my mission, I think, to get people past this stigma that is still around the cannabis industry. It's a lack of education is one of the biggest issues, I think, plaguing the cannabis industry today. The negative stereotypes surrounding the cannabis users are all still very, very present, and I think it's still portrayed as lazy, ignorant, and apathetic, and the perception of the stupid stoner is still there. And that's just not the case when you're talking to the clinical, providers for medical professionals. Well, we know that, some of these stereotypes sound really harsh, and a lot of them, are false. They hold, some real implications because it gives it a bad name. So my mission with the Florida Medical Cannabis Conference and Exhibition is to rise above these damaging perceptions. One way that, that we are doing this is by bringing a level of professionalism into the industry that simply just doesn't exist currently. I've been to multiple different cannabis events, and it's more recreational, I would say, than it is scientific. So the cannabis industry is still in its infancy stages, and it has reached a pivotal moment in history, and everybody that's attending is at the forefront of not only, a new industry, but also a global movement. So I urge people to become part of this movement. What we do today has massive implications for our future. Therefore, medical professionalism can't be forgotten in the industry, because the consumer needs us, the doctors need us, and we need to, provide, the real true scientific data.
Yeah, absolutely.
That was a long answer.
Oh, no, that's perfect. Recently, there were some reports coming out trying to shed another bad light on the Florida medical marijuana program. Suggested that 1 in 5 doctors had received complaints that are qualified ordering physicians, meaning they had some kind of mark on their record with the Department of Health. So it is vitally important, I think, not only for the patients and people wanting to get in the movement, that professionals like yourself from the medical community as a physician are actually out at the forefront, but more importantly for your colleagues. Could you maybe give our listeners a little bit of a taste of what it's like still in the medical community? I know there's still a lot of skepticism amongst physicians.
And that's to, myth versus facts. Like, what is fact? What is a myth? And like I said, you have this industry that is promoting cannabis as medicinal, but yet it's not treated as a medicinal, plant. All the conferences that I go to, and you see all these vendors everywhere, and people, I go to conferences in Las Vegas and in Colorado, and they still have, booths with people tasting, and testing out supplies of different cannabis products. And to me, as a healthcare professional, I'm a pharmacy owner. I own CGMP companies. I own outsourcing facilities for pharmaceutical manufacturing. It's like, can you imagine the consumer coming into my pharmacies for them to test out Xanax and seeing which product works best for them? It's like, here, have some Valium, have some Prozac, have some Trazodone, have some Wellbutrin. I mean, that is so unprofessional. You don't do that. People need to realize, just because something is natural and it's from the earth doesn't mean it does not have the propensity to be abused. Water, for example, is the most natural substance on the planet, and it's required for life, right? But you can abuse water, and you can become waterlogged, and you can die. It'll mess up your electrolytes and your minerals. There are thousands and thousands of cases each year where people abuse water, drinking too much water. There is such a thing as becoming overly hydrated. So you can't just go and, test somebody's product at a booth without, first talking to a healthcare provider. Vitamins and minerals, you can abuse vitamins too. You can overdose on certain amino acids. You can overdose on, minerals. You can overdose. I mean, there's been cases all over the country where someone, a prescription was written, for example, L-arginine in a neonatal unit in a hospital in Florida. And then all the babies died because the script was written in milligrams as opposed to in micrograms. And so you could see that. There you go. There's a natural, substance, and someone abused it. So it's the same thing. There will be side effects, and the consumer needs to know that just because something is natural, you don't overdo it. More does not necessarily mean, better. So it needs to be medically supervised. It needs to be in the hands of doctors, and they need to be properly trained, pharmacists as well, because if this is medical, who handles medicine? Who has the degrees for this? Doctors, pharmacists, RNs, right? And you go to these dispensaries. Are there any of those people in those dispensaries? Do you talk to an RN? Is there a pharmacist talking to you about contraindications with medication use? For example, if a vet came in and went to a doctor and got, his card for medicinal cannabis, and went to a dispensary and no one was there to ask him if he was taking warfarin, and he got a high THC product. What are the contraindications with that? Okay, nobody in that dispensary would know because none of them are actually healthcare professionals. This patient would die because he's on warfarin and THC.
It's really dangerous.
Yeah. So then he's going to take THC, which is also a natural blood thinner, and he's going to take warfarin. He's going to bleed out. He's going to die, and they're never going to link it, to, but everyone still says, well, there hasn't been any deaths with cannabis. It's like, but you don't ask the question, so you really don't know if there has been. We could be killing people right now, and people are so unaware, and that's just that's medical incompetence. You can't do that. You can't call something medicine and not have the medical personnel within those facilities. So I'm also on a movement to make sure that that this changes. We need to have our hands on it. Pharmacists need to be involved. Doctors need to be properly trained. 2 hours to 8 hours of training on something is a joke, and that's what's currently going on right now. Can you imagine going to a neurologist that only had 2 to 8 hours of training in that field, or an OBGYN that only had 2 to 8 hours of training? No, that's another,
horrible.
That's malpractice. You can't do that. You want to be properly trained. You want to be able to have a system that's in place. There's a lot of work. That's what I mean when I say that the cannabis industry is still in its infancy stages. There needs to be education before recreation, and patients need to be aware too of the equal amount of dangers. I had my mother-in-law, Robert, I sent her to a local dispensary, and if there was a pharmacist there that she would have been able to talk to properly train her instead of a 16-year-old, tattooed, lots of piercing everywhere. She said it was so unprofessional, and they treated it almost like it was like a illegal operation with the security. And I'm going, oh my gosh, this is so bad. I'm so sorry you had this experience. She got into a car wreck right after she left because she took the THC oil, and she said she couldn't even remember where she was. That shouldn't have happened. Someone should have been there to tell her, don't use this right now. Take this and gauge yourself at home. There should have been an auxiliary label. It should have a script on there with the warnings on where to take it and how to build up a tolerance for it. Wait to see, engage yourself. How much is too much? How much are you gonna get before you're gonna feel like you can't function? Because there is such a thing as getting too high. And I have news. Yeah, I have news for everybody. Everybody that's out there that is chronically ill, not everybody wants to get high. I would say about 96% of the population, they do not care about getting high. They care about getting out of pain. They care about not having seizures and epilepsy, and children with Dravet syndrome, and children with, spasticity or gait or, migraines. There's so much that cannabis can be used for. But it's not the high that is intriguing everybody. And I think people are just focused on, probably the THC aspect of the cannabis plant, when really the THC is not the powerhouse cannabinoid. It's really the CBD, which has no psychoactive properties whatsoever. So I would say about 4% of the population actually need THC. And if you have too much THC and you have a neuropsychiatric disorder, it could work backwards. It can actually overstimulate your neurons and make your symptoms worse. We get it all the time in our centers, our pharmacies, our clinics. People come in and are like, well, I went to this dispensary and I got this, and I got paranoid, I got heart palpitations. I was, looking over my shoulder, and I swear I thought people were following me. I mean, this is not what we want. We don't want to just have a society of people that are paranoid and anxious. And we want people to get better, right? So isn't this the whole goal with this industry, is to make people better and to increase the quality of life of the consumer?
I think so.
Yep. I'm too passionate, if you haven't noticed.
No, that's great. We love passion on the Marijuana Solution. This is perfect. Real quick before I let you go, though, because we just had a little bit of time, can you let everybody know where they can see you upcoming, where they can see you on TV, and connect with you on social media to follow along with what Dr. Wilkins is doing?
Yep. I have several pages. I have a public page on both Instagram, Twitter, and Facebook. You can look up, you can find me by Dr. Jenny Wilkins, Wilkins, and my pharmacy, AgeVital, AGEVITAL, AgeVital Pharmacy. both Instagram, Twitter, and Facebook as well. They could also go to www.agevital.com. We're actively posting all the different events that I speak at. I speak at the MJ BizCon. I speak at the American Academy of Pain Management. I speak at the Southeastern Cannabis Conference and Expo, the Florida Cannabis Conference and Expo, which is June 1st through June 3rd. I urge people to come, to that, because we'll have patient workshops, we'll have provider workshops. And we're expecting a good turnout. We had a massively successful 2017, and people were just hungry for more. And everything that they'll learn at this conference is going to be all about, clinical applications for cannabinoid pharmacology, for pharmacokinetics and pharmacodynamics. And these answers, just the more elaborate answers than, we have time to discuss today. But yeah, that's where they can find me, or send me an email at jenny@agevital.com. That's a good way to reach me. And I do have a couple shows on, I have a show on NBC daytime every Wednesday at 10 o'clock a.m. And I do the Suncoast View, which is on ABC 7 in Florida. So there's a lot of different TV things that I'm doing, and hopefully I will have a network television show all about health and wellness soon.
Awesome. And we hope to let everyone know about it, Dr. Wilkins. I really appreciate your time that you took out of your busy schedule today to speak with us. And I look forward to meeting you in person next weekend in Sarasota.
Yeah, I look forward to meeting you too, Robert. Thank you so much for the opportunity to come and give a Reader's Digest version of the cannabis industry.
Yeah, absolutely. And I really appreciate it. And my listeners are going to really love it. And we will make sure to have all those links in our description of the podcast. And until I see you again next week, I hope that everything in your life is happy, healthy, and wise, and I'll see you then.
Thank you so much. You have a great day.
Thanks. You too, Dr. Wilkins. The Marijuana Solution would like to remind you to check out our sponsors after the podcast. We're going to have links to them in the description. Our sponsors are TrueLeave, Sunshine Cannabis, The Smart Collective, Minorities for Medical Marijuana, and We Are Rare. Don't forget to check out those links in the description, and if you haven't done so already, go ahead and subscribe. Leave us a review.
Aware of the marijuana solution.